Hi, I'm Ada Wells, physical therapist and certified Pilates instructor, and welcome to the ProBalancePT channel. Today what we're going to talk about are shoulders. And shoulder issues are very common. I often see them kind of at the beginning of the year when people have gone crazy with their new workouts, with the New Year's resolutions coming around. And what happens is they start having some shoulder pain. It's nothing to write home about, so they try to see if they can, manage it. And what happens about 6 to 8 weeks later is that now, it's not going away. I need to go in and see somebody. So oftentimes that's when I end up catching these patients. But there's so many things that you can do if you recognize when you start getting that pain right away to make sure it doesn't get to the point where you do have to end up seeing a physical therapist for a longer term. So let's talk shoulder joint. I don't have a shoulder model. I wish I did. But basically, the shoulder girdle is fairly complex. It actually is comprised of 4 joints, and one of the joints actually being kind of a pseudo joint. It's not really a real joint. But if we look at the front, so here's our glenohumeral joint. That's actually the shoulder. So when we think of I've got shoulder pain, this is my shoulder. This is the joint right here. This is the head of the humerus, and this is the scapula. This is the shoulder blade. And so that area right there is, once again, glenohumeral joint. Okay, so then you have the clavicle here that comes in the front. Now, the clavicle is going to basically be attached to that shoulder blade. That's what's helping to hold the whole shoulder onto the body, onto the rib cage. So if we don't, so we need to then address, there's a joint that's right up here, kind of at the tip of your shoulder. It's called the AC joint. When you hear somebody having a separated shoulder, it's that joint has become overly stretched. And then there's a joint right here, it's called the SC joint. Now if you take your arm and you move it up and down, you might even feel a little bit of that movement of the clavicle, and that's very important. That clavicle, or the collarbone, when you raise your shoulder up and down, it actually rotates. Sometimes if people have an issue and maybe they're stiff at the joint here at the SC joint, or they're stiff here at the AC joint, what happens is that then you don't get that rotation. So people come up, they try to move up here, things get stuck, and then you start getting this elevated motion of the shoulder, which is not a nice motion that we want to see. So there's 3 joints right there. What's the 4th? The 4th joint here, you can see my particular shoulder blade. I'll kind of poke it out here so you can really see it. That little triangular joint, that's the scapula. And basically what should happen is when you move your arm up into the air, that scapula is going to also move out to the side. Okay, that's normal, that upward rotation. Now, what we don't want to have is we don't want to have elevation. Now, there's going to be a slight amount of that, but you don't want to have more elevation than an upward rotation. So if you see somebody, and I say, raise your arms up overhead, and I see this, that's not a healthy shoulder motion. That's going to be the person that's going to have a lot of neck tension. They're going to have shoulder pain. If they don't have shoulder pain now, they will have it later. So you really want to keep those shoulders out of the ears when you're bringing those shoulders up overhead. Same with when you're going out to the side. So notice I have that motion of the shoulder blades going back and forth. Now, let's say you're sitting at a desk and you've got some excessive tightness here, and there's one particular muscle. I wish if I could cut it out of people I could. It's called the levator scapulae. Now this muscle, it's a bear. What it does is essentially it elevates the shoulder blade and it downwardly rotates. Those are the 2 things that you don't want to have happen when you're lifting your arm up. So if that levator scapula has been overly tense because you're sitting there at the driving your car in traffic, or you're sitting at the computer, or you're doing this, then it's overstimulated, so it's going to be a lot harder to actually access those stabilizing muscles of your shoulder, which will help you to have those normal mechanics. And so sometimes with my shoulder patients, I find if we don't get rid of this muscle tension up above, it's very difficult to strengthen and to retrain the movement for those lower stabilizing muscles to have that healthy movement. So that's why a lot of times I give my patients and clients just exercises where they're lying on a foam roller, or they're lying on a ball and trying to get a little bit of mobility through this area, and then we can overlay the strategic motions to try, because now we can actually find those little muscles that we need to stabilize. So going back to the stabilizers of the shoulder, what are they? You might have heard of the rotator cuff. Sometimes people say rotator cup, and it's actually rotator cuff. It's a group of 4 muscles, and basically the goal of the rotator cuff muscle is to hold that head of the humerus within 1 centimeter of the center of the socket. Okay, so here's our socket. So it basically acts as a sandwich to stabilize that. If that rotator cuff muscle is not, if that group of muscles is not kicking in properly, what you end up having is a lot more of this excessive motion. The problem with that is you've got a lot of, you've got, bursa, and you've got your other tendons up here. that are in this area. And so what happens is if you get a lot of this banging up here every time you raise your arm up, that starts giving you some wear and tear, and pretty soon people start having the shoulder tendonitis, the bursitis, which is basically inflammation of this fluid-filled sac, and then that can actually lead to rotator cuff tears down the road. So, you know, do you need surgery if you have a rotator cuff tear? You know what, lots of people have rotator cuff tears, but their ability to manage the rest of the mechanics of the shoulder really depends on if they end up needing to have surgery for something like that. A lot of times you can actually do a lot of conservative management and work on the stabilizers and the movement patterns throughout so that you don't need to have surgery. If you're an elite athlete and you need to have that, that may be a different story. So anyway, so that gives you a quick, just sort of a quick overview of the shoulder joint. My main cues whenever I'm doing exercise with shoulder is, once again, if you're bringing your arms up overhead, it's not squeeze your shoulders back and down and bring it overhead, but it's just maintaining this space. Think about, you've got two little balloons that are just maintaining a little bit of space at your shoulder. So when you lift up your arms, you're keeping the space, so we're not getting that elevation, but we're just allowing for that upward rotation of the shoulder blades. When you are sitting at your desk, at your computer, once again, watch where you place that mouse. If you have that mouse and it's up here, you don't realize that you're doing all this, and pretty soon you start getting excessive tension, then you start getting symptoms in your arm. So that's going to be a problem. One thing that sometimes will happen that kind of comes out of nowhere is something called a frozen shoulder. It tends to affect women over the age of 50. Sometimes we don't really know what causes it, but oftentimes the symptoms are, you know what, I just noticed it was harder for me to put my jacket on. I couldn't reach behind to get my seatbelt. And what happens is they stop moving it. And so you have this inflammatory phase within the capsule, or the sort of the deep ligaments of the shoulder. And over time that starts developing scar tissue, and the shoulder freezes up. They lose that motion. And so part of it is we do have to allow, there's a time period where things just get irritated and they have to settle down. But really the fight is then restoring that range of motion and then restoring the strength and the mechanics back in the shoulder, because you're only as strong as the motion that you have. If you can only move here, you're only strong in that little motion. You have no strength out here. So obviously life and where things get hurt tends to be up above here. So that's why people might say, you know what, my shoulder feels fine here and here, but it's out here in the middle where it's the most difficult. And that's usually when people have a little bit of that impingement and have some of those faulty mechanics that's feeding into pain in some of these areas. Okay, so that's just a quick overview of the shoulder. Nothing really super specific. We can go into more specifics in future segments, but at least you have an idea of sort of what composes the shoulder. Okay, we'll see you next time.